So the simple answer is that knee replacement surgery offers very high success rates. We wouldn't be carrying out approximately 100,000 knee replacements across the country if it wasn't a good operation. But it's important to counsel patients, to have them on your side so that they understand what they should expect from surgery and what they should expect from the recovery phase from their surgery, because a lot of hard work is involved with physiotherapy and rehabilitation. However, the National Joint Registry does show very high success rates, but satisfaction rates are essentially based on informing patients of what they should expect after surgery. And I spend a lot of time counselling patients in this regard. In respect of complications, there are a number of complications. These include infection, thrombosis, swelling, stiffness, damage to nerves or blood vessels, early and late loosening, etc. But in the majority of cases, the patient does very well, and a good joint replacement should last an average of 10 to 15 years without problem.